Hello PSA members. Today I really just wanted to take some time to talk to you all. To say that the last few weeks had been an emotional roller coaster ride for many of us is really an understatement. PSA's priority and my priority is to ensure that we can deliver the best outcome possible for our profession. Pharmacists are my people, and I feel really upset when I know that pharmacists are upset. But I want to reassure PSA members that PSA is absolutely doing everything we can within the confines of the law. I do want to say that PSA is here with you, with the members of the profession, to try to deliver the best possible outcome for our profession and for the patients that we care about. We're continuing our advocacy efforts and call on closer alignment between the commencement of the 60-day dispensing policy and the commencement of the new community pharmacy agreement. We're also not forgetting about other pharmacists who are practicing across other areas and with other specialization areas who are also worried about what it means to their career, whether it's to do with medication management review or their work in aged care facilities. The challenges that we're facing at the moment as a profession really requires a multifaceted approach. And I think we each have a lot to do and we each have our role to play here. And the main thing at the moment for the situation that we are in at the moment is to maintain a functional dialogue, meaningful dialogue with the department and with the government. I know that having a dialogue can't guarantee the outcome that we want, but what I do really know is that when there is no dialogue, when there is no conversation, we can guarantee that there would not be any outcome. So that is why PSA is focusing our energy on making sure that our profession can have meaningful dialogues with policymakers and decision makers. Members would know that our Minister for Health and Aged Care, Minister Mark Butler, made the announcement about his commitment for conversations, discussions and negotiations for the 8th Community Pharmacy Agreement to progress soon. I wanted PSA members to know that PSA has received a non-disclosure agreement by the department, which we are currently seeking legal advice, and we will be signing that imminently so that meaningful discussions can commence. And once we've signed the NDA, I wanted members of the profession to know that PSA will be limited in terms of what we can and can't say in relation to CPA and related matters moving forward in the immediate few months. But I do want members to know that PSA is here and is continuing to advocate, and we're not slowing down our efforts at all. I also want PSA members to know about the direction and some of the decisions. So Dr. Shane Jackson, who is our PSA 8 CPA negotiation lead, will continue to lead the negotiation from a PSA perspective in relation to 8 CPA. Shane will be supported by our very passionate PSA 8 CPA working group, as well as, of course, Steve, our CEO, and myself, and the PSA policy team. The entire PSA board is 100% focusing on how we can deliver the best outcome possible for PSA members and for our profession, more importantly, because we genuinely believe that pharmacists have so much that we can do to help support Australians, but we must be supported to be able to deliver on those roles. We just cannot continue to do more for less because it's simply not possible and not sustainable. What we need to see is pharmacists receiving adequate remuneration and that there are meaningful reinvestment to ensure that the services that we provide, that Australians rely upon, can continue. And this will benefit ultimately the patients and Australians that we care so much about. And in that regard, and I've previously mentioned in some of my videos and communications as well, that we absolutely must be advocating for remuneration and meaningful reinvestment to address access to care and pharmacists' role in improving medicine safety. And the services that pharmacists do must also be underpinned by quality and standards. I wanted also PSA members to really take some time to look after yourself. I've always said, support each other, but this is actually a very challenging time. So please, PSA members, take some time to look after yourself, do some self-care and mindfulness this weekend if you can, and check in on each other to make sure that we're all okay. Stay strong, members of the profession, and please know that the Pharmacy Support Service is there available to support members of the profession should the need requires, but please continue to look after each other and look after yourself.